Hi everybody, and welcome to our show. When anybody becomes sick, using the resources that are available is critical to staying independent. Sadly, many people don't get the help they need when they leave a hospital, but taking advantage of those home health care options can make all the difference.
I had a dead gallbladder inside of me.
Lois faced a big challenge when it was time to leave the hospital.
Going to my meals, I had to have the walker, or going to the bathroom, I needed the walker.
And when she got home, Lois still needed to rehab, and in-home therapy was there to help.
They would have a chair over here and a chair over here, and I'd have to walk between the chairs.
Lois is now healthier than ever thanks to the home health care model, which brought therapists to her.
I walk a mile a day and enjoy every bit of it.
Lois did all the right things. Geriatric physician Dr. Donald Murphy told me home health care is helping many people just like Lois.
It is a good model that's serving the patients and their family members very well.
So this is really like going back into the olden days when the doctors made home visits.
A lot of times the seniors and their families will comment on that. Geez, I didn't know we did that. We did that way back when Dr. So-and-so came and saw me as a kid.
Let me give you a hypothetical situation. I'm the daughter, my mom has just fallen and fractured her hip. What call would she make and what processes would she take?
You want to hear from the primary doc in the hospitalist, about what to expect. At least in our practice, we will pick up your care once you go to the nursing facility for rehab.
Okay, great.
Or if you need a home visit, let's say you're able to go home rather than to a nursing facility. We'll then pick up the care and make sure we follow up with a home visit, or you need to come into the clinic, either of those things. You as the family member are helping tie everything together, but you have to have the input from the providers.
We're joined now by Suzette Gerald, a registered nurse and the Care Transitions Coordinator for Amedisys Home Health Care. Thanks for being here, Suzette.
Thank you for having me, Christine.
Lois is a prime example of somebody post-discharge utilized home health care services for physical therapy. Tell me what types of services home health care offers.
Home health care offers various services, nursing, therapies, rehabilitation from orthopedic surgery, education for various illnesses and injuries that you may have, maybe a new diagnosis of diabetes or cardiac disease, and we can educate you and your family on how to best care for you at home. We do wound care, pain management, and many more things.
How does a patient or an adult child request home health care services post-discharge?
You could contact your doctor or a doctor who is caring for you in a hospital, skilled nursing, or rehabilitation unit and see if you meet home care eligibility criteria.
And who pays for these services post-discharge?
If you have Medicare, it is paid for 100% by Medicare. Other insurances, private insurance and Medicaid, do have some payment options, and you can check and see the eligibility criteria that you may have for those.
And Lois's example, she came home, she could only walk from maybe 2 feet, and by the end of the 6-week physical therapy episode, she was walking around the lake.
Yeah, we have many examples of patients like Lois who have been able to do their rehabilitation in the healing environment and the comfort of their own home, where they're under control of their own situation and able to heal in a quick way and have just as successful results as people who are in rehabilitation units.
And everybody wants to be in their home. Right?
Most people do express to me that they would rather be in the comfort of their own home, on their own schedule, and doing things the way that they're used to.
Thank you so much.